All right, Kevin. I wish we could get your feet in, and you know what? I'll add a link with a picture of your feet the way it was,
okay,
because it is something to see, guys.
Yeah.
Can you describe your feet to me?
Now or before?
Before.
Before, it was really bad. I had a fire on my feet and caused really bad blisters, not to mention the pain. I am so thankful because I don't have any pain. God has healed that. He's used you and your staff, which I would say is a miracle. I really would, and I'm so thankful for that.
Kevin, by the way, had CRPS in both his feet.
Yep.
How did it start, Kevin?
I had a hernia surgery, and I think that sort of set things off. I couldn't do much for about 3 months after the surgery, and then I tried to get active, and I usually have been pretty active. Tried to get to the golf course, tried to ride a stationary bike, and I started having trouble with my feet. And first it's plantar fasciitis, then it's gout, and it continued to get worse. And it just really flared. And wow, thankfully the doctors started to see we don't know what to do with this. I mean, the people I was seeing are like, this is just, we can throw pain pills at this, but that's not the answer.
I remember the day you and your wife stopped by, because you're actually from Arkansas.
Yep.
It's really unusual.
And thank God for that. What a miracle that was too, that I'm right here. Now that you mention that, she knew Kylie Haggard that she played volleyball with. And
your daughter did.
My daughter did, Olivia, and Olivia goes to Dallas Baptist. Well, she was home in November and she saw that I had this, I was saying it's plantar fasciitis. She's like, he's talking about a burning pain. And she apparently touched base with Kylie, who had chased this thing for, I say, 3.5 years, and found out that Kylie was going to see you to get treated in March. And so out of the blue one day, Olivia calls me and she says, Dad, don't go chasing this thing. I've talked to Kylie, who's chased this, and she's got appointments with Dr. K, and she said, I think you need to get over there. And so I remember calling to make an appointment. We came by, you looked at my feet and you said, I think that is what you have, and we need to try to treat that as fast as we can, because I haven't had it a year. And you said, if we can get you in. I said, well, I'm local. You'd put me out there till, I think April 9th was the soonest I could get in. All these people in my church praying. Oh my gosh, I got moved up almost a month, and I'm serious as I can be. I needed to be, because my feet were just continuing to get worse. I mean, when I came here, I was wearing sandals and moccasins. And it's just amazing.
You've come a long way.
Yeah, I would say your staff, you knowing what to do, and sometimes God allows things to happen that they look like they're really bad. And we've talked about this. My central nervous system was basically on life support. And I had no idea, but I remember sitting at home when I had this fire on my feet, this burning pain. And I remember saying, I wish my brain could stop this. But obviously I didn't know how to do that. It didn't dawn on me that we should be looking at the central nervous system. First thing you did when you got me in here was looked at my central nervous system, and I remember what you kind of said to me, and I was like, goodness. It was almost too much for me to digest. But as the process went along here, and as I started to heal, and I'll never forget the first day you treated the vagus nerve, I had this burning fire in my toes, and you said, what do you feel? And I said, I feel a burning fire in my toes, and you said, what do you feel now? And you were treating it, and I said, it's moved to the middle of my foot. And then you kept treating it, and you said, what do you feel now? And I said, it's out of my right foot, it's gone. Now, obviously it came back, but the point was my body was already starting to be receptive. The very first time you started to work the vagus nerve, I will never forget that. And I realized, okay, that's why these treatments are at least 10 weeks, because you've got to treat this and get it back to where it needs to be.
And throw up firewalls so it doesn't come back?
Yes.
You're amazing to work with. The staff loves you, and you're ringing the bell when?
Is it May 17th? It'd
May
be week
17th.
10th. It'd be
Just
Thursday.
a few weeks. That's crazy.
Yeah, and I really mean this. If you are, I can't tell you how much this staff really cares about people. And if you really have something along the lines of chronic pain or your central nervous system, and I know there's a lot of other things, I just strongly recommend you at least visit with Dr. K and her team, because I just know before I came over here, praying you would know how to treat me, and I have no doubt in my mind that God said you need to be here, and I'm just so thankful.
We're gonna get this done.
Yeah.
Remission and better.
Yeah, that's right. And you know what? I just can't. I think the other piece of this is, for me, the burning pain. I've never, and I know you've seen it in people that are full body, and I can't get my brain around this really, but I know one night I woke up and it was like somebody took a fiery torch to my foot, and I've never experienced anything like that in my life, the burning pain. And I've thought to myself, why do not more people talk about this? Why do they not raise money for this? It's a serious need for people that don't know where to go or don't have the money to get treated, because it's not always easy to get treated through health insurance because of the way things work. And so there's some huge needs, and it really opens your eyes. And goodness, the people that I've met here, amazing. Not just even staff, but some of the patients and stuff that you become friends with because you share a common bond of, you know, I want to get over this. I want to beat this. And I, as you've heard me say several times, with God all things are possible, and that's, anyway, I'm thankful.
I am too. I'm so excited about you ringing the bell, and we will put that video up, and I will post a link for you guys of his feet before and after, because it's quite amazing.
Thank you again.
Oh, you're welcome.